Many people and governments officials have declared the pandemic to be behind us. So our 9 Health expert, Dr. Payal Kohli, is with us now to talk us through these decisions. So CDC has new mask guidance. It seems like mask mandates are falling by the wayside right and left. Is that a good decision at this point? And where should people, individuals, stand on this?
So, you know, the science does support, because the cases have started to go down, that perhaps we can start to ease up on some of the mitigation measures, particularly masks. The problem is the implementation here, Tom and Kim, because it's so sudden, it's a little bit jarring, and it's very confusing, in my opinion. I also think it leaves a lot of vulnerable groups sort of left behind. You're talking about the immunocompromised, the pregnant patients, the young kids that are not yet vaccinated. What happens to their rules? So I think that's where the individual decision making is really going to play an important role, because now it's no longer the government telling us what to do, it's us assessing our risk and assuming responsibility.
Yeah, it's interesting how now virtually anywhere you want to go, you don't need a mask. Unless, like, you walk into work, we wear a mask, or if you go into healthcare settings, which kind of always makes me say, what do they know? It's put on a mask.
Well, and it's so true, and it seems to have happened overnight. You know, because last week we were wearing masks everywhere, and then they changed the metrics that we were looking at. So the idea here, of course, is correct, which is that as our risk goes down, we change the metrics we're looking at. But how do we actually do it in a way that keeps us safe? So personally, I'm still wearing a mask when I'm in a large group where I don't know the vaccination status of other people. I don't know their health status, to protect myself, but also to protect them as well.
I think a lot of people just read the room. If you see that nobody's wearing a mask, you go along. If you see people wearing a mask, you probably have them with you and you put it on and see how that works. I want to ask you about something out of left field a little bit. It seems to me that in my observations that fewer people are sick. The mask wearing and the distancing and all that the colds and flu, you know, we talked about it last year, not really having a big flu season. Is that accurate? Are we learning something about how germs spread?
Very accurate. We're seeing it in adults, we're seeing it in kids. People aren't getting respiratory infections like they used to. And that whole hygiene hypothesis that you have to get sick in order to build your immunity, that's an old theory that most of us don't really subscribe to. But I think it's just a really important point to make in general, which is that we are now in a honeymoon period. I akin it to being in a bad relationship. Usually you have the honeymoon first and then you go into the bad relationship, right? This case, we had the bad relationship first. Now we're in a honeymoon period. This is the time potentially for us to be on our best behavior so that we can change the future tomorrow, not make that new variant emerge by being safe and keeping our guard up.
That sounds messed up that you would have a bad relationship and then have a honeymoon. But
it's COVID.
We also want to touch on kids, because I know many schools are saying no more masks for the kids, like DPS, but we also vaccines, we're still talking about it. And then Pfizer is talking a little bit. What would you tell parents right now? Would you still get your child vaccinated?
Vaccinated for sure, because remember the efficacy data that we're seeing about vaccines, which says now 12%. There's only one study. It's pre-publication, and it's the raincoat analogy, guys. If we're out in a really bad rainstorm with an umbrella, it's going to offer less protection, right? So this efficacy data is coming out of our Omicron peak, which was super high.
Oh, right.
So now that that's better, the vaccine is going to protect your kids, and there's good protection against serious hospitalization. So my nephew, for example, he's only 4, he's not yet eligible for a vaccine, but I told his parents to talk to him about how he feels about wearing a mask at school, and he loves it.
I think if you're going to have the bad relationship to honeymoon thing, you should have a prenup.
We should have thought of that in 2019.
That's a really good idea, Tom.
That's got nothing to do with anything. Dr. Kohli, it's always good to see you. Thanks.